Hello, Shockers, and welcome to the Student Government Association's virtual town hall. Before we get started, I'd like to shine light on recent events. Tensions are running high due to continued police brutality and racial injustices. The association would like to once again reiterate that there is no place for that in our country, in our community, nor on our campus. Actions will be taken to make sure our Black students and all students feel safe, welcomed, and included at Wichita State. Without further ado, my name is Rija, and I'm your student body president. Today, I have the pleasure of hosting nurse practitioner for Student Health Services, Cynthia Walker, Assistant Vice President of Student Affairs Wellness, and Director of Counseling and Prevention Services, Dr. Provines, Vice President of Student Affairs, Alicia Newell, and Director of Disability Services, Isabel Medina Keiser. Thank you all for joining SGN today in hopes of addressing student concerns and issues on student wellness as we all navigate our roles and responsibilities during the coronavirus pandemic. For those who are tuning in with us, welcome. We will go ahead and start with a few general updates. Up first, Dr. Provines.
Thank you. I just want to reiterate what you said earlier, and make sure that all of our students at Wichita State knows that wellness services, as well as CAPS, stands with our students, particularly our Black students, as they continue to witness violence and so many brutal killings of people of color, and that we recognize that these times are very emotionally trying and can trigger a lot of trauma and a lot of intense emotions. And we just want students to know that we are here for you, and that we have resources available to you if you need help and assistance as you're grieving with the nation during this time of injustice and unrest. And we hope for an end to the violence, and that all shockers are safe.
Thank you. And now a general update from student government. As some of you know, that this association recently announced a state of emergency. This allows the Student Government Association to function until the fall semester. The Senate is usually not in session during the summer, so an emergency legislative council was formed to continue governing amidst the COVID-19 pandemic. Senate will continue to stream at 6:30 p.m. on Wednesdays on our YouTube channel if you'd like to tune in. Please feel free to ask any questions or concerns you may have in the comment box, and we will answer those today at the town hall. SG also provided students a way to submit questions prior to going live, so we can take time to answer some of those questions as well. Now, we're going to move directly into the questions. Let's begin with, what are some ways that we can support each other as peers during this time? So if anyone has any suggestions, you all feel free to speak.
Well, I wrote a couple things down that I thought was important. One of them was just making sure that we continue to communicate with each other and stay connected, no matter how we do that. That may be like we're doing today, video conferencing, emails, texts, sharing something that's positive, because we know that there are a lot of trying times, not only this pandemic, but what's going on now. So we need to try to support each other. And so staying connected is one way that we can do that. And then my second thought is in regard to COVID-19. I know that there's a lot of information out there, but you want to make sure that you have the accurate information, the most reliable. And so that's why on WSU website, there's a link to, and also on Student Health Service page, a link to reliable information. So just don't take everything face value, but you want that reliable information.
Thank you. All right, and I would also like to just echo the answer of the previous speaker. Stay connected, stay positive, and if you feel like that you don't know what to do, reach out to the people around you. And we have some great people on this panel today that you can reach out to as well. And so don't be afraid, and be safe, and be able to reach out to others. Now we can move into our next question. Coming before the start of fall, If a student gets COVID-19, what will be the protocol for the campus? Will we be notified?
Okay, thank you. I'll address that. So, as you know, there are a lot of important factors to consider when we're looking at that issue. But one of the major issues or concerns is making sure the health and safety of the campus community is maintained. The second thing to consider is the privacy of the individual. So, when you look at COVID-19, it is a reportable disease. And for those of you who don't know what that means, is there are some diseases that have really high health importance. And so as healthcare providers, we are required to report these to either state or local agencies. And so what will happen is if someone does test positive, if a student tests positive, the Secretary County or our local health department will work with that individual to identify anybody that they've come in close contact with. And CDC defines that as being within 6 feet for a prolonged period, which is like 10 to 15 minutes within the last 14 days. And if that is so, then the Sedgwick County Health Department will notify those contacts. And then the individual themselves need to quarantine for the specified amount of time. Student health services, we will be notified, but of the positive, but the individual's name will stay confidential. So we will not know who the individual is, but we will be aware that there is a positive case.
Thank you for that answer. And just to be clear, that would house every single person, the students, staff, faculty, correct?
Yes.
All right, thank you. Now, what are some tips we can use for the summer to manage stress and the feeling of nervousness?
I'll go ahead and take that one. Cynthia already talked about staying connected, which is really helpful. And another important thing is to try and find some kind of routine where you are getting up around the same time daily, engaging in activities that help you be productive. It's important to get up, get dressed, take care of yourself, get out of the house, and enjoy at a safe distance, and using masks, being able to get outside, get some exercise, to eat properly, all of those basic self-care items, where you're eating well, you're sleeping well, and you're getting physical activity. Those are really important to maintain during social distancing, and if you're socially isolated, to make sure that you're taking care of your basic needs first. Then we also, encourage practicing mindfulness, doing some things that are pleasurable and are fun. It's important to try and schedule those activities, like do something fun. I know one thing my family enjoys doing is watching AFV, America's Funniest Home Videos. It always makes us laugh. And so doing something that makes you laugh can be really helpful. And I would um, also recommend, with the uncertainty, is trying to focus on the present moment. And that's where mindfulness can help a lot. When we spend a lot of mental energy thinking about past events, we can find that we're feeling a lot of sad emotions, a lot of regret, a lot of loss, um, and some trauma in there as well. But then when we're also focusing on the future and the unknown, we oftentimes experience a lot of fear and anxiety and worry. When really trying to focus on the present moment, the here and the now, can help with that. So if you were to practice a mindfulness activities, it helps you learn how to stay in the present moment. So that's one of the reasons why we really stress that, and we're doing mindfulness live streams to help students know how to focus on the present moment and manage the unknown and all those uncertainties and anxiety.
Thank you. So Now we know if, everyone wants to be on campus. It would have been a wonderful time if we were all still there and the pandemic wasn't a thing. Now, taking care of ourselves is a big deal, but for the fall semester, since we will be coming back on campus for classes, what will happen if a faculty member gets COVID-19? What would happen to the classes? Would the class still continue, or would that be moved forward to some other professor, or would that be transitioned online?
I was going to say, Alicia, Camille asked me to ask you if you would address that since it's kind of an academic issue.
Yeah, I think by all means necessary that the department would really try to make sure that we find additional faculty to cover this subject to make sure that the courses continue throughout the semester. And so working with the department chairs of making sure that everything runs fluid and that students aren't skipping a beat regardless if we have to switch instructors or not.
All right. Thank you for that answer. Now, what is student health doing to prepare for the fall semester?
Well, the good thing is we have been here the whole time, so we've had a lot of time to kind of work on this and work on our processes. Currently our processes we have in place, they won't really change, but I'll go over some of the things that we are doing now. So as of June the 1st, to enter into Student Health Center or Student Wellness Center, you need to come through the YMCA on the east side. About a month ago, that was a little different. Students were entering in the back door, but as of June the 1st, they're going to be entering in the front door. Other things you may notice that have changed is our appointment. So we're encouraging all students that have any signs or symptoms of illness to make sure they call and make an appointment before they show up. We're also encouraging all students to call and make an appointment. That way we can monitor things a little bit different, and then we can also make sure there's social distancing that takes place. Other thing you'll notice when you first come into our area is students are going to be asked to wash their hands with hand sanitizer. If they have their own face mask, they'll be asked to remove that and put on one that we will give them. You will also notice at the front desk there will be a panel there, a glass panel. Some individuals call that a sneeze guard, a way to protect the staff and the students. In the lobby, to help with social distancing, the areas are marked off so everyone won't be close together. We've also tried to separate the sick or that have symptoms from those that are well. So there's a process that we will do with that. You'll also notice that our clinical staff, when we come to get a student, everyone will have their goggles on. We'll have our masks and our gloves on. And depending on if there's some suspicious or something else, you may also see our staff with their gowns on. The sick will be placed in a separate hallway than our well students. So that has helped. As far as our other services, our professional providers will still be there. The hours may be limited for Dr. Keller starting off, but we have our ENT and all our other specialists will still be seeing our students there. Another thing that we started when this all started was curbside pickup for refill medication, so students wouldn't have to come in. So we will continue that. So if students have refills, any medications that are on file with us, they can request that through My Chakra Health, our portal, and then they can pick those up at curbside. They would just call us, and one of the staff members would bring those meds out to them. We also started doing TB reads curbside, so those have been really accepted by the students. And then one of the last things we also started doing was looking at telehealth. We weren't for sure if we're going to be able to be in student health or if we're going to have to do some things outside in our home. But again, we were able to stay, but we have instituted telehealth, especially for our mental health visits. And currently we're looking at our contraceptive management with our women health nurse practitioner, and then also some other disease processes, giving students options where they may not have to come into student health services, but we may be able to help them through telehealth or telemedicine. So that's been really encouraging. So we're going to continue to just work closely with our local and state departments, and then we will make adjustments as we need to. So
Thank you so much for that. I can assure you that students are very thankful for the department making active efforts to adjust to this pandemic. Now, what is counseling and prevention services doing to prepare for the fall?
Thank you for that question. Since mid-March, when all of this started escalating and we had the close down, I'm really proud of our team at CAPS for being able to pivot so quickly to a telehealth remote uh, format. And we continue to remain seeing students in a remote format through an online platform. Um, we are continuing to review that and to see when it'll be safe to start seeing students in person. For the time being, we are planning to continue remote services, and then we are looking at additional safety precautions, in the therapy room, like sneeze guards in between the therapy chairs, possible clear face masks. So it won't be so challenging to understand communication through a cloth face covering. And then, having proper sanitation and hand hygiene practices, as well as the 6 feet safe distancing. So I hope that helps students feel more comfortable. We're really taking safety very seriously and want to make sure that before we would start doing in-person services again, that it was safe and that we have all the proper precautions in place. Um, to get in, we still encourage you to call and schedule an appointment at the Student Wellness Center number. That's 316-978-4792. You can call that number and schedule an appointment, and we will be available to meet with you. We're also making sure that students have all of the important crisis resources that they need to have 24 hours a day if there's any kind of safety emergency. And so it's important for all shockers to save the National Suicide Prevention Lifeline number in their phone. That's 1-800-273-TALK. And it doesn't have to be a safety emergency. It could just mean that you're really lonely and you just need someone to talk to. You can call and talk with a trained mental health professional 24 hours a day, or you can text the crisis line at 741-741. So we're trying to make sure that our services are available and that we have crisis services available as well.
Thank you for that, for all that you do. Now, going on to the next question, is the care team still meeting this summer to support students? And what do we do if we have concerns about other students?
Yeah, so care team, we're not skipping a beat. As we receive reports on a daily basis, we're continuing to reach out to those students and the reporter and collecting as much information as we can to ensure that we can support the student, as well as the faculty or staff or reporter, just to make sure that we can provide those wraparound services for students. This summer, we are meeting virtually. And doing everything that we can. We're really focusing on trying to identify more community resources for many of our students. And, especially as students begin to return home, is finding resources in their community that will be able to help provide the necessary means in order for them to maintain both personal and academic success until they're able to join us back in the fall. If an individual feels that they need additional support, or they're just struggling, or life isn't treating them kind, at any time, a report can be submitted at wichita.edu/care. That comes directly to the entire care team, and within 24 business hours, I like to say, or less, they will receive communication from one of our team members to see how we can help get them the support they need.
Thank you for that. And what does the care, or what will the care response look like coming fall?
We are planning to operate essentially the same. So anytime we receive a care report, we immediately call the student, and if they don't respond, we send an email or a text message asking them to schedule a meeting with us. Right now, we're purely going on the guidance, same as, student health and counseling and prevention services. And so as soon as it's safe for us to meet face-to-face with students again, we will do so. Until then, we will continue to meet with them virtually. Whatever it is that the students need, we're still able to provide those same services. It just may look a little different.
All right, thank you for that. Now, we all know that fall again, we will be on campus. We will be not required, but encouraged to wear face masks. Now, with the professors having to wear masks, what if I am hard of hearing and use lip reading? How will that impact me?
Well, thank you for the question. I'm assuming that's coming to me. My name is Isabel Medina Keiser, and I'm the Director of Disability Services. And if you are a student that is hard of hearing or deaf, and you're registered with our office, we will provide face shields to the interpreters and to the professors so the students can still read the lips of the interpreter or the professor. We will again be emphasizing the need for social distance of at least 6 feet. Go Create is going to supply us with the face shields. If you are hard of hearing or deaf and you're not registered with our office, I would suggest that the student contact us at our office at 316-978-3309 or email us at disability.services@wichita.edu.
Thank you. Now, this again goes to disability services. Will golf cart services for disability service still be available for the fall?
Yes, we will still provide golf cart services in the fall. Again, as everybody else has said, things are going to look a little bit different because we need to maintain social distance. We've had plexiglass installed on the golf cart to try to separate the rider from the driver. We're going to encourage our riders and drivers to wear masks. And currently we have a working group that is focusing on improving golf cart services for students and faculty and staff. So there may be some other further changes.
All right, thank you. And what is disability services doing to prepare for the fall semester?
As stated already, we've ordered face masks. We've prepared our golf cart for social distancing. We've placed sneeze guards at our front entrance area. We have disposable face masks if somebody forgets their face mask, if they show up to the office. And we have plastered our office with signs reminding everyone to wear their mask and follow social distances.
Thank you. Now, we all know that we don't know what the next few months or even the next year might look like for us, but us all being here and having to discuss this is a big step of transparency and a big step of informing students as to what they can expect and allowing them to have the opportunity to ask questions about wellness. So thank you all for being here. I would like to thank everyone who submitted questions and tuned in for today's virtual town hall. As we begin the summer, please do not hesitate to reach out to any of these individuals or myself if you have any other questions or concerns. But before we wrap up, I'd like to encourage all to attend the Candlelight Vigil hosted by the Multicultural Greek Council to mourn recent events and rally as a community. Take some time to learn and reflect. The vigil takes place at 8 p.m. on Friday, June 5th in the courtyard east of the Radigan Student Center. Thank you to all of our panelists who joined today, Again, thank you all for tuning in, and I hope you stay happy, safe, and healthy. And remember, it's always a great day to be a shocker. We hope you join us for our next town hall regarding student fees and tuition on June 18th. Thank you.